I'm Natasha Lubczenko. Welcome to your CT Style Express health update. Millions of Americans are diagnosed with coronary artery disease each year. If you or a loved one are affected, there are minimally invasive options available right here in New Haven County. I spoke to a doctor at Waterbury Health to explain, and at any point throughout this story, you can click on the QR code at the bottom to learn more.
We've saved countless lives. We've opened countless arteries.
When it comes to heart attacks, Dr. Stephen Widman and his team know that time is of the essence.
The longer the artery stays closed, the more heart damage occurs. So the faster people get into the emergency room and the faster they get up here, the more heart muscle they save.
Now, open heart surgery used to be the standard, but interventional cardiology and a procedure called coronary angioplasty has changed that.
It involves passing a long, skinny wire down an artery through a long, skinny tube called a catheter.
And whether it be an emergent or elective surgery, the downtime is impressive.
People are out of the hospital either later the same day or the next day, as opposed to bypass surgery where people typically stay 5 to 7 days.
Now, patients place their head here, and this imaging device allows doctors to see the heart in real time.
Utilizing this machine, the X-ray machine, we guide the catheters up to the heart and then insert them in the arteries that supply the heart with blood. We inject dye, that radio-opaque or IVP dye, into those arteries and take a movie.
Dr. Widman shows us one of those films.
And you can see right here that there's a severe blockage right at the very beginning of that artery.
And if the patient is qualified for an angioplasty, this room can quickly turn into an operating room.
People with single blockages of relatively short, not an extensive amount of blockage in an artery, and not multiple arteries blocked, are very appropriate for putting stents in.
Here's how it works. The catheter has a tiny balloon at its tip.
What we aim to do is open up those blockages, and the balloon compresses them. It squashes them. And then a stent, it's a wire mesh device, squashed up against the wall of the artery to hold it open. People return to a normal life with adjustments, dietary, activity, medication, that sort of thing. The things that they ought to do to protect their heart going forward. Our goal is to make people whole again as quickly as we possibly can.
Now, if you'd like to learn more about this procedure and others, scan the QR code or visit waterburyhospital.org. Thanks for watching today's CT Style Express. I'm Natasha Lubczenko.